dear colleagues, dear Rheumatology Society, dear Journal of Rheumatology. This is a great pleasure that the journal actually picked our article named Traditional and Disease-Specific Risk Factors for Cardiovascular Events in ANCA-Associated Vasculitis as the editor's pick in the current issue of Journal of Rheumatology. This article really brought together a lot of people, a lot of investigators in the field of ANCA-associated vasculitis, ranging from the Americas over to China, which included a significant proportion of the patients. Cardiovascular disease is a key issue in ANCA-associated vasculitis and is a driver of premature mortality in our patients. This is a study from the partners in Boston looking at 429 patients, of whom 269 had MPO ANCA vasculitis and 160 had PR3 ANCA vasculitis. You can see that there is an increased mortality rate in comparison to matched background population. So observed in opposite to expected deaths was actually a bit of a twofold increased. And then the authors looked specifically at the causes of death, and you can see that cardiovascular mortality here also was increased by 2.3-fold. This is a rather contemporary cohort with a long-term follow-up of 7 years. This study here looked at patients in the UK and a huge data set combining different forms of cardiovascular events, 12 in total. And what they have found that when you lump together all the vasculitides, either localized one or those with systemic character, such as ANCA vasculitis, you still have an increased hazard ratio that you will develop a cardiovascular event. This was not so pronounced as in systemic sclerosis or, for instance, in SLE. But again, you have, of course, also localized vasculitides contributing to this. I would guess if you just look at ANCA vasculitis, you would see a significantly higher rate of cardiovascular events. The study from British Columbia, or using a British Columbia dataset, looked at myocardial infarction and stroke as a combined endpoint, and then looked at that specifically and adjusted it for a couple of different variables, including age, sex, and entry time matched and to the background population, and found that if you look at myocardial infarction and you use 504 patients with GPA, you will see a significantly increased rate of myocardial infarction. This increase was actually seen over time. And similarly, the trend was at least there for stroke, but the event rate overall was quite low, with only 18 events in the GPA group and 107 in the control group. So this was not significant, but the trend was similar there as with myocardial infarction. In our study, we have combined different cohorts from all over the world. So overall, we had 2,286 patients, one of the largest ever study in ANCA-associated vasculitis. And you see that there is a fair proportion from patients from China, from Russia, from the European Union, that was everything except the UK, and a good proportion in the UK and a smaller proportion from Turkey and from the USA. Highlighted here, and that's important, patients in China were older than in the other different areas. And these patients more frequently had, as we know, microscopic polyangiitis, were more often MPO ANCA positive, and more frequently are women then. Importantly as well is that the kidney function in those actually with ANCA vasculitis in China was actually the poorest at baseline, and this also contributes to the finding which I will show you on the next slide. So here is the main result. We found that 10.7% out of 2,286 patients had a cardiovascular event during follow-up period, myocardial infarction in 88.1%, stroke in 3.2%, and 0.6% presented with both actually MI and stroke. The median time was 17.5 months, indicating that active disease has a role, but is not as prominent as, for instance, for venous thromboembolism in the occurrence of cardiovascular events. Among risk factors identified in this multivariable analysis, we found that smoking, higher age, pulmonary disease, kidney disease, and Chinese origin contributed to this increased risk of cardiovascular events. Chinese origin, as mentioned, patients were older, were more frequently microscopic polyangiitis patients with MPO anchor positivity, and of course had a lower eGFR at baseline. We hope that our study contributes to the field, will develop more specific treatments, also focusing on cardiovascular events, reduction of cardiovascular events, as we have new treatments such as SGLT2 inhibitors in our hands, and will also help to improve the outcome of patients with ANCA-associated vasculitis. Thank you very much for your attention.